This Good to Go segment is made possible by Spectrum Health Medical Group.
In an emergency, time is precious, including the moments before help arrives, which is why it's important that more of us are trained in basic life-saving techniques. The Stop the Bleed campaign is a nationwide effort to educate the public on proper ways to help stop active bleeding from a wound in an emergency situation. And here to talk about the campaign and a free class offered by Spectrum Health is Meaghan Crawley, an injury prevention specialist and registered nurse at Spectrum Health. And it is good to have you here.
Thank you. It's good to be here.
This Stop the Bleed campaign is relatively new. What's it all about?
So it came as a response really to the Sandy Hook shooting back in 2012. But the American College of Surgeons realized there are so many situations where somebody might be faced with needing to stop life-threatening bleeding, and really training the public on how to recognize that and then what to do with it to make sure somebody can make it to the hospital.
Yeah, so tell me about the campaign itself. What does it do?
So what we do, we really focus on training the public on recognizing what bleeding is too fast for someone to not survive before they can get to help. And we teach them to use materials that they have available to them to get bleeding to stop through like direct pressure, using any sort of material that you have, and then also training the public on the use of tourniquets to get bleeding to stop.
Yeah, a tourniquet to me is a scary thing. Like if I feel like if I put on a tourniquet, that's almost, and see, it's probably ignorance, and that's what you're going to help me not be so scared.
Right.
But it's a critical thing to know how to use.
It is so critical to know how to use, and it's so easy to use, which is really important. And the other piece that people are sometimes afraid of is that tourniquets are dangerous. But honestly, it's a very safe technique. There was a long study that came out of the military that actually showed that when a tourniquet's in place for fewer than 2 hours, no amputations have been caused. And more likely than not, whether or not an amputation is going to occur is determined at the time of the injury. And by putting the tourniquet on, getting the bleeding to stop, you really enhance that person's survivability.
Wow. Now, you have a kit here. So tell me a little bit about this.
Yes, so this one right here is one of the training aids that you get to use in the class, and you practice using material and putting it into the fake wounds that are in there to simulate wound packing and direct pressure. And you can put on a tourniquet and you really get the hands-on practice of how tight you have to put it down, twisting the rod, and making that, that physical connection of, okay, I just listened to this, but this is how I actually would do it.
Yeah, and this is the kit that you use in your class for the actual training.
Yes.
And it's almost like muscle memory, I'm guessing, like having done it, really done it in the class, if you're ever presented with the need, you've already walked through that in your brain. And
Well, and it's just like we tell all of our medical personnel, when you're faced with a crisis, you go back to your most basic level of training. And so by making this the most basic level of training, like you said, it's muscle memory, and people can really fall into it nice and easy.
Now, there is also a kit that people can either purchase or assemble themselves that will put together the materials that they might need in a situation.
Yes, if you want to buy a pre-made kit, you can go on bleedingcontrol.org. That is the website that is sponsored by the American College of Surgeons, and all the materials in that kit are approved for use. If you want to make one yourself, you just need a tourniquet, you need some gauze to pack a wound, some gloves. Those are really the most basic components.
Now, we're talking gunshot wounds, and it looks like gunshot wounds on this sample, but that's not the only reason why you might need this training.
And as I've been an ER nurse for quite a few years, honestly, I have seen so many situations where we needed this education and training for car accidents, industrial accidents, farming accidents. There's so many different situations when somebody could bleed out.
And of course, if you're the person there who's witnessing it, your first reaction is, in a lot of cases, panic.
Yes.
And you want to remove the panic.
Yes.
By taking this class, by having a kit at the ready, you're removing that panic and giving a sense of confidence about how to respond.
Yes, because if you've been trained on what to do in that situation, you already are at another level of confidence, and you're more likely to jump in and help.
All right. Well, you can learn more at stopthebleed.com, and this next free Spectrum Health Stop the Bleed course It's at 10 a.m. on March 5th in Grand Rapids, and we've put the information on how to register on our website, along with a phone number to call if you want to host your own class. Go to 13onyourside.com. You'll find it there. Good to have you here, Meaghan. Thank you for doing this. So important.
Oh, yes, of course. Thank you for having me.
And thanks to all of you for watching. Make it a great afternoon.